Hi, welcome on Guide. And we are talking about decision making in plastic aesthetic periodontal surgery. In this presentation, we will go through different decision making process that we have when we decide the technique to apply. First of all, to understand when we need mucogingival surgery, in which case do we need, in case we don't need, and why we need. If we do nothing, what happens? We know that from the literature there is some technique. There are some techniques that are more efficacious than others, and can change and improve the soft tissue. But if we do nothing, what happens? And we can also know what happens doing nothing, because there is evidence from Giulio and co-workers published on JCP results after 27 years that the soft tissue will continue to get lost, and the recession will be more deep and deep and deep over the years. And also we will underline some surgical factors that are key point. For example, I give you one. One is the flap tension is very important. So we know, according to the Pini-Prato evidence, when we want to be predictable, the flap tension should be less than 4 grams. What does it mean? It means that if the flap still has a residual tension, you will be less successful. And if the tension is 10 grams, you will be 50% success and 50% not. We want to be 100% success, so we want to be sure. And we will see how to release, in this case, the periosteum in this way to be sure that we can achieve a complete free tension of our flap. And then there are other parameters that we will analyze during our conversation. We will go into the different techniques available, the coronally advanced flap, the double pupillar flap, the lateral position flap, and when to place the connective tissue graft or not. And also the decision making has been published in this paper. We will go into details of this. So when to, for example, in case single or multiple recession, any presence of knot or keratinized tissue will influence our judgment, and the biotype will tell us when to graft or not the cases, at the vestibule depth, and the neighbor tissues. And we know that the Miller class 3 are more successful when treated with the tunneling technique. So this is a very true indication for tunneling technique. And we also will go into details of the surgical approaches with the coronally advanced flap, for example, like in this case, and or in laterally positioned flap, for example. We try to describe exactly how to perform the incision in order to be able to replace our flap laterally and to be predictable. And it's very important also the long-term data, so the stability of the root coverage with the 9 years results. We are going to publish this technique, so you will see this data even before they are published. And we published this technique in advance before, and now the question is when to use the connective tissue graft or not. Is so mandatory to be used. And so this is the results after 9 years. When we use the connective tissue graft on the left side, you can see we have a continuous improvement after 9 years of the regrowth of the tissue. When we don't use, but we used only the coronally advanced flap, as you can see, there is a little relapse of our procedure. So it's better to use the connective tissue graft. And see you on the entire lecture soon. Ciao, bye-bye, Giulio.